disaster that we're continuing to deal with this week, COVID-19 and its impact on Mobile County. Worldwide, we are nearing 32 million cases of COVID-19 and almost a million deaths, so 962,000 deaths. In the U.S., we're around 6.8 million cases and around 200,000 deaths. I believe you probably saw that in the news that we're approaching 200,000 deaths in the United States. We have around 20 or 22% of the world's cases and deaths related to COVID-19. India and Brazil are still second and third in cases and deaths, and India has the second most cases, and Brazil has the second most deaths. In Alabama this morning, we're looking at 145,780 cases of COVID-19 with 2,439 deaths. So for Mobile County today on our daily update, our daily report, we reported 13,158 cases of COVID-19. This included 58 cases of COVID that was added yesterday on Sunday, which is slightly higher than we've seen in it's actually the highest as we've seen in the last 14 days, but probably impacted by some changes in reporting at the state health department. On Sunday, we had 27 cases, and then last Friday, we reported 30 cases. But overall, over the past week, case counts have continued to be low, although we do see them go up and down throughout the week, depending on things like Sally and closures and labs that are closed or have delays in reporting. So we may see a few artificial spikes this week in the early part of the week as things are coming or have come back online. So for hospitalizations, we have a total of 1,950 patients in Mobile County that have been diagnosed or have tested positive for COVID. Again, this number includes Mobile County residents and people outside of Mobile County who seek care in Mobile County hospitals. We have 292 patients who have died. And then on any given day, we're averaging a really low number of cases in the mid-60s of patients hospitalized with COVID-19 on any given day. So again, I know I kind of jumped around a little bit there, but 1,158 cases, 292 have died. So that's still in the 2.3%. And in the last 14 days, our daily count has been below 60 cases per day for the last couple of weeks. We're still seeing in Mobile County sort of the greatest increase in the number of cases reported in that 25 to 49 age group. Again, if we look at it by week, last week, the week ending September 19th, we had 241 cases, and that has continued to decline since, the week ending August 9th. So we are seeing this steady decline in the number of cases of COVID-19 cases that are reported through the traditional public health system. But I just want to mention, we've talked about this before, there is a shift from the traditional PCR testing that takes sometimes 24, 48, 72 hours, sometimes longer. But we're seeing a shift away from those tests that we are sure that most of those are being reported to public health towards what are called point of care or rapid tests that are becoming available at nursing homes and at urgent cares and doctors' offices, and some schools are getting them. And so we think that there are a lot of COVID diagnoses out there that are not being reported through the traditional public health network. And so our cases that we traditionally report on are probably a great underrepresentation of the full burden, but the important news is that it's moving in the right direction. Cases are down, deaths are down, the number hospitalized every day are down, and those are good trends, even though we are sure that what we report in our daily report is an underestimate of the true burden of disease in the community. For the number of cases, if we look at the 7-day average, averaging less than 40 cases a week. For the hospitalizations, if we look at the 7-day average of hospitalizations, we're averaging less than 75 cases each week in the hospital. So these are really important things that, again, are all moving in the right direction. So thank you for continuing to do the things that you need to do to protect our community, wear your face covering, keep a 6-foot distance away from others that don't live in your household, wash your hands, don't touch your face, disinfect surfaces, those sorts of things. We have a new figure in the report this week. It's figure 7. This is information from hospital emergency department visits. So throughout the state, all of the hospitals in the state of Alabama participate in the National Syndromic Surveillance Program that is executed or facilitated by the Alabama Syndromic Surveillance Program. We affectionately call them ALYSYS, Alabama Syndromic Surveillance. And all of the Mobile hospitals submit daily data on people who go to emergency departments for treatment. And we're beginning to share, in line with what the state has done and what CDC has done, the percent of visits for influenza-like illness among all visits and the percent of visits for COVID-like illness among all emergency department visits. Now, these definitions are ones that are created and validated and shared by the Centers for Disease Control, and we apply those same case definitions so that we can try to be comparable. We can see, even in the emergency department data, is that we had that huge spike in July, and since July, emergency department visits for COVID-like illness have continued to decline. The number of influenza-like visits is much lower than the percentage of visits for COVID-like illness. And if you think about it, the same things that are protecting you from COVID also will protect you from getting influenza and other upper respiratory viruses. So, covering your face, wearing a face covering, physical distancing, washing your hands, not touching your face, these things will also reduce the spread of influenza in our community. So we think that might be why we're seeing such a low level of ILI, of influenza-like illness. But having said that, it's not too early to get your flu shot. So please, there is flu vaccine out there. Please go and get a flu shot for seasonal flu to protect you against flu. And then, when the COVID vaccine is available to us, then we will promote the uptake of the COVID vaccine as well. So I think that's probably all the data points that I wanted to cover today. Again, our map has been updated with the last couple of weeks, and we have hired a new GIS analyst, and so we're excited that Justice is going to be able to start helping us expand our mapping of COVID cases, and we're thankful to Pat and Chandler for assisting us to date and coaching us as we are better able to do this ourselves going forward. So the only questions we had today, had one on Facebook about what is the percent positive. I think this is probably referring to the percent positive laboratory results. We have not been able to include this in our weekly report for about 3 weeks because the report that we rely on at ADPH has not been populating properly. We've been working with them to try to get other ways to access the data. So we are not able to give that percent positive laboratory test result figure by week for Mobile County for the last couple of weeks. But looking at what others have done, the state of Alabama is seeing anywhere from an 8 to a 10% positive rate of, 10% of all laboratory tests reported to them are positive for COVID-19. If you look at the Centers for Medicare and Medicaid Services, who calculate percent positive for nursing homes to make some decisions, they're reporting anywhere from 5 to 7%. We talked to some of our community providers, so some urgent care facilities around town. We talked to them to see what they're seeing. Those point of care tests where you get a really rapid results are seeing a higher percent positive than the traditional PCR test. That's probably not expected because we think that if someone really thinks they have COVID, if they've been around someone with COVID and they have symptoms of COVID, they're going to want to know right away if they have a positive test result. And remember, there are some reasons to not rush to get a test if you think you've been exposed, for example. But anyone who wants to get tested for COVID can get tested for COVID, whether through a private provider or through the Mobile County Health Department. We should have all of our services back online by the end of today or tomorrow, certainly. So you can contact 690-8889 to schedule a COVID test if you want one. No charge to you and no screening criteria. So that ends our COVID update today. Just to re-emphasize what Aaron said about staying safe after a hurricane, stay out of flood water, never use a wet electrical device. If the power's out, use flashlights or other artificial battery-operated lighting instead of candles because of the fire danger. Prevent carbon monoxide poisoning by making sure that your generators are in an area where it's well ventilated. Never use portable gasoline or coal burning equipment or camp stoves, inside your home or your garage or your basement. Be very careful near damaged buildings. You think it might not really be a wall that's about to fall down, but if you move a limb, then it comes down on you. Those are really challenging things to deal with. Stay away from power lines. Hopefully everyone's power has been reconnected, but if you still see some power lines out there, please stay away from them. Protect yourselves and animals from pests. So make sure that you've got plenty of insect repellent with DEET or picaridin. Wear long sleeves when you're outside. Stay outside if you can. And then drink safe water and eat safe food. If you have food that has gone less than 40 degrees for 2 hours or longer, you should throw it out and listen to local advice on drinking water. Wash your hands. Take care of your wounds to prevent injuries. Clean up your home safely. Don't overdo it. And take care of your emotional health. After being at home for 4 or 5 days without power and really just feel like the entire world must be in a disaster zone, I just found it very uplifting just to, ride to try to get a gallon of gas for the generator and just see, wow, there's a whole world out there of people moving around and moving about, and it just uplifted my spirits so much. So please take care of your emotional health. Connect with family, friends, and others in your community. Take care of yourself and each other. Know when and how to seek help for emotional health. And again, just take care of yourself and your neighbors. Reach out, talk to people, keep that distance, but connect just to try to keep your mental health and your emotional health positive during the cleanup and aftermath of Sally. And we still have other storms brewing. So if you realize that you didn't have the batteries you needed or you didn't have the weather radio that you thought you should have, please go out and get those things because we are not out of the storm season yet. There are plenty of storms brewing in the Gulf, and we'll continue to watch those and keep you updated. So stay safe, everyone. And as long as everything goes well in the Gulf, we'll see you again on Friday with our COVID-19 update.